What made you decide to speak out? Why today? Why now?
So I think it's important at this point with the numbers in the county of people who are hospitalized to take a stand. This is crazy. We're doing things that are crazy, and I think we have to protect the populace, and the numbers have just gotten too high. They have not been this high before.
I agree with John and Morgan. I would also say that I worry not only about the people in the community, but I worry about the healthcare providers. People are running out of gas, they're burning out, there are shortages, they're pulling people from outpatient settings to do inpatient work because there aren't enough providers and nurses and other folks who help take care of people in the hospital.
Before we get into the fair stuff, any thoughts about, just the pressure you're getting from, it seems like every angle?
Yeah, I work in the outpatient, and in the outpatient, my colleagues are very fatigued. The stress level's the highest I've ever seen it. We have people that are changing positions, leaving positions. I have patients that are afraid to go to the hospital. I have patients that won't go to the hospital. The other day I had a 63-year-old woman who had some kind of pulmonary process, and she sounded terrible. I went and did a home visit on her. Her oxygen was horrible. She did not have COVID, but she wouldn't go to the hospital because of fears of what could happen there. And I had another patient that went and spent 8 hours in the emergency room and didn't get seen and will not go back again. And so I think people are very, very stressed and don't know what to do.
I agree with John. I'm also seeing delays. So just today I saw a patient who had a big lump in his throat and he was having a hard time swallowing, and he needs, in my view, urgent biopsy, urgent treatment. But he was told, well, we'll try to get to you next week. So if you can't eat and you can't drink, it's really hard to be not in a hospital. So that's another concern I have, in addition to what John talked about, that things are being delayed. Biopsies are being delayed, procedures are being delayed, colonoscopies are being delayed. These are people that don't have COVID who are being impacted by the patients hospitalized with COVID.
This is definitely something where people could die.
Yeah, without question, people will die because of our choices. And, we as a society have decided that we're okay with that. And I heard today that 1 out of 500 people in the United States have died from this. And I know 5 people personally who have died, and so I must know 2,500 people, or maybe it's because I'm a health professional. But there are people who are dying because of the choices we're making, and I think it's time to make different choices.
So I want to pivot a little bit to the county fair. Legally, having the fair is okay, but do you think that morally, the community leaders, the county commissioners, Dr. Frank Velasquez, they have a moral responsibility to shut down the event?
So I've been a health officer, and there's 2 questions there. I think from a community health perspective, the answer is it should be shut down. From a moral perspective, I think we all have to answer that, how we need to answer it. I think that it's the wrong thing to do. I always think about what's the loving thing to do, and the loving thing to do is to try and protect my neighbors, to take care of my community. And I feel like I have a moral obligation to take care of my community, but I can't speak for others with respect to that.
Do you think that the community leaders that have allowed the state fair to take place will be responsible for the outbreaks, if not deaths, that could come from this?
Well, that's a hard one. I would again, I'd echo what John say. I always look at what do we do to improve the health of the public and keep the public safe. And I'm just not sure we're doing that. And I do hope there's accountability for that, as we look forward. I recognize having a fair is fun. I have kids, they would love to be at the fair. They love the whole thing. We're not going. So I know that's a sadness and a loss, but I think on balance, taking care of the entire community is more important.
I love elephant ears, and I'm sad that I didn't get an elephant ear this year, but at the same time, it's clearly the right thing to be doing, not going.
John, I know that you've been a health officer before. Why would Dr. Frank Velasquez allow this to go on, knowing what we know about the cases?
He's in a very difficult position. We had one county health officer that was fired for not working as well with the commissioners or other staff potentially as possible. And when it was, I think, related to that person, Dr. Lutz, speaking out. And so Dr. Velasquez has to walk a very delicate line. And at the same time, I think being a health officer is not a popular position, but sometimes you have to say no. This is a unpopular decision, and there's repercussions from it. So in Ellensburg, they had a fair, and their numbers bumped as a result of that. Kootenai, 10 days prior to this fair, or this outbreak, had a fair, and my bet is that their numbers bumped. There was the Stampede in Omak, their numbers bumped. And so we're allowing things to happen that we know increase deaths. And I think it would be good to stop some of those things from happening. And again, I like fairs. I think they're fun.
Michael, Sacred Heart and Providence has been sort of the backbone of Washington's eastern side. You're taking in so many people from Idaho now. It seems like everything that Providence has said and everything that Providence has been doing didn't mean anything to the people who are making this decision. Do you think that, have doctors been betrayed?
That's a good question. I'll say, I'm doing outpatient as well. I chose not to do inpatient at Sacred Heart at this point. But I do think, I just can't say enough how stressed the colleagues I have who are doing inpatient here in Spokane and across the state. I have people from Western Washington calling me saying, I can't keep up. I'm getting transfers from all sorts of communities. So it is really taxing the system. And as John mentioned, I'm having colleagues and friends saying, I can't do this anymore. I'm running out of gas. So I think, there's a shortage. Some of my friends who are outpatient, primarily people, are being pulled into the hospital. So that's super disruptive to them and their practice. They're canceling seeing people in the outpatient setting, and they're disrupting their lives and having to change all sorts of stuff to be able to do inpatient. So I do think I think it's unfortunate that we're not being more careful with our healthcare team, all of them. And we're just running out of people.
Yeah, and Morgan, I would say I do feel betrayed. This doesn't have to be this way. And the reason it is this way is absolutely confusing to me. We as a society have made a choice to allow more people to die. And we seldom make that choice as a society. We wear seatbelts, we wash our hands after we go to the bathroom. We say those are the right things to do. The right thing to do in this case is to pretty simply wear your mask, consider vaccines, get the vaccines, and stay 6 feet apart. And so it's what we've known for a long period of time. And the reasons we're not doing it is just confusing to me.
Yeah, and that leads me to a really good follow-up. You used to be a public health officer. You're not anymore. What happened?
So I actually enjoy the work quite a bit, but it octupled in terms of the amount of work that was necessary to continue to do it. And it was an opportune time for me to step away because there were a couple of good candidates for the position that I was aware of. And so I left it in the hands of very qualified folks that I felt very comfortable with. At the same time, it took a lot of energy to deal not with health. The healthy part of it is easy. It's the political public component of it that's not so easy.
Why do you think the air around healthcare workers changed so dramatically? I remember last year around this time, people were clapping when doctors were going into hospitals and when nurses or any type of healthcare professional. What happened? What changed?
That's a good one. I think there is a mistrust in many people of the healthcare system. And I think because of the internet and Google, people are looking stuff up and there's a lot of misinformation out there. So there's a lot of confusion. And I think with this pandemic, things change. We're used to that in medicine because one year we're treating certain diseases a certain way. The next year we decide, or there's a study done that shows it doesn't work, and then we pivot. So we're used to uncertainty. But I think what's happened is with the pandemic, our knowledge is changing over time. And so as physicians, we're like, okay, that's just what happens. But people are like, I've been lied to. So I think there's an overall mistrust. And I think in addition, it's been sort of politicized. And it's like, if your team is one, then you get vaccinated. So I worry that the politicization is actually helping feed this pandemic, and people are dying as a consequence.
I just add to that. I think that misinformation is phenomenal at this point, and so we should be teaching people in this age of information at our fingertips to how to figure out what's true information, what's real information, and what doesn't have basis in fact. And people will believe anything. I always tell people, you can find a doctor that will do a surgery when it's not indicated, or give these medicines or that medicine, but there is some truth. And there is some transitions of truth, but I don't think people have any ability, or have very limited ability, to figure out where the good sources, the valid sources of information are coming from.
I feel like healthcare workers are just hammering home the same point over and over and over again, and nobody is listening. And it must feel really, it must be very frustrating that our own community isn't listening to the healthcare workers.
I think it's sad. Some people are listening, and I really appreciate it when I can have a good conversation and help educate somebody. I have a very difficult time when somebody's mind is made up and their facts are their facts, and I can't have a conversation with them about it. So I think it's a comment on our society, and I'm not so much frustrated as sad that this is where we are today. I've been around for a little while, and we weren't like this 20 years ago.
And I would say it adds to the stress of the healthcare team. Every day I'm in clinic, I walk in the room and people don't have their mask on because it's all fake, and so I have to gently remind them to put the mask. So it becomes adversarial often right off the bat. It doesn't need to be that way. I take care of people with kidney transplants, and even if they're vaccinated, they're on immunosuppressant medicines, and they don't always mount a response. And so if people are in a room without a mask, and the next person comes in with a kidney transplant and there's virus floating around, they're in deep trouble. So I'm trying to keep the next patient safe, but it turns into this adversarial posturing sometimes, which I agree with John. It's sad. It's like, where to start? And I just would hope that people would want to take care of their neighbors.
Do you think that the fair is continuing on for the same vein as why Dr. Lutz was removed?
Yeah, I'd say that we're not dealing with medical decisions. We are dealing with political decisions. That's I feel very strongly about that. Having worked with Dr. Lutz as a compatriot, as a public health officer, he was great. He was great. And to lose him, and I think that was a political decision. I'm sure he had some other issues that were involved in that. And that's a real tragedy, that we are determining health by politicians rather than physicians. And it would, I think that's where the accountability comes in, is how we as a society to choose to deal with this.
Do you think that there should be something that changes in the future? Why is it that a health district board and county commissioners who sit on the board don't have and never worked in the medical field? Do you think that should change?
Absolutely. So I worked with a county commissioners and a health board, and I think it's really important to have the electorate's viewpoint brought forward, but I think it's also really important with the public health board to understand public health. And you're absolutely correct that the level of understanding is not as high as it should be, and it should be made up by people that truly understand public health and have education in that field. So I think that's a huge thing, and I think the state was working on changing that, as you probably know.
And I think to follow up on that, I agree with John. I think even just trying to read the literature, it takes skill. The medical students, we have courses on how to evaluate a paper. Is it valid or not? Is the methodology accurate? Was the sample size adequate? Was it peer reviewed? So we work really hard for our trainees in medicine to help them to learn how to dissect the medical literature. So if you have folks who aren't trained in how to read medical literature, that to me doesn't make sense.
Why do people think that they know more?
That's a very intriguing question. I have patients who come to me routinely and say, I give them my spiel, and they say, well, I need to read a little bit more. And it's as if I have not read enough for them. And my guess is they're not reading as much as I am. And I don't know what their sources of education are, but they probably don't have access to the journals and the literature I do. And so there's some sense that they're going to do that, but I don't really think they do that. I think they go home and turn on the TV and listen, and that's tragic. I don't know how to do plumbing very well, and I would ask, a plumber to do it. I wouldn't say I know how to do this, or I wouldn't look at a YouTube video for a complex issue. I would say I need some help with this, and that's not happening. And I would say you can get, again, physicians who will say anything. So there are physicians that will hear this broadcast and will say, wait a minute, I totally disagree, and I was trained in the same modality. And I don't think that that if there's a minority of physicians that say that relegates truth.
Baseline, how are each of you doing emotionally?
So I'm fatigued, and as I said, sad. I'm sad really for the populace of our community and the poor choices it's making, and I don't think it heralds well for the future. And so, but in terms of my personal ability to tolerate this, at this point, I'm doing relatively well with that. And I do get affected by people who die that I care about.
Yeah, I've had several of my patients die of COVID that weren't vaccinated. Young people, I had a 38-year-old die, healthy. So that's devastating. We do our best to keep people healthy. So to have people dying of something that probably was preventable, with the vaccine, they might have gotten infected, but it wouldn't have been as severe. That's really difficult. I'm doing okay though. I still enjoy my work. It's hard to stay on time though. I have to say, I really try to stay on time and respect my patients' schedule and what they're trying to do. But to have these conversations, I spent an hour today talking to one patient about the need for him to get vaccinated based on the immunosuppressant medicines we were giving him. So it's taking more time. And so I'm doing a lot more in the evening and calling people because I can't have all those conversations during the day. So it's a sadness to me. How many thousands of people across America are dying that didn't need to, and the families that get demolished, and the kids who don't have parents anymore. It's just really hard to watch for me. But I'm I'm hanging in there, I would say.
Yeah, and I'd also add that, I work with the Native American population, and some of those who have died have been elders. And I think that that's very difficult to see a culture, a society that's being devastated that doesn't need to be. And some of that comes from within, and some of that comes from without in terms of vaccinations. If we all were vaccinated, there'd be less disease, there'd be less variants, there'd be less devastation, there'd be less death. And unfortunately, we haven't figured that out yet.
And the economy would be better. So if you're, into the economy as a primary driver of decision making, we'd actually be better off in the economy if everyone got vaccinated.
I mean, look at New Zealand.
Yeah. That's what's confusing to me. If your major decision making is about finances and the economy, we're actually be better off if everyone got vaccinated.
Yeah, and that was known early on, and early on measures. It was very clear that if you want to protect the economy, the best thing to do is follow public health mandates. And unfortunately, that didn't occur. And our children, your children, our grandchildren will be paying for our decisions. And again, I find that sad that we weren't able to, as a society, say, let's work together and solve this. We decided instead that I need to maintain every individual right. I think it's a combination of that which will make a society stronger, is taking care of each other as well as taking care of ourselves.
Yeah, and I guess my final question is, people have said who have avoided getting the vaccine that getting the vaccine is a personal choice. Do you believe that?
Well, washing your hands after you go to the bathroom is a personal choice. Wearing a seatbelt is a personal choice. We make all kinds of personal choices that have community effect. And it is a personal choice that has communal effect. And because of that, it is also a community choice or a community affect that we need to deal with. So it's both. I can decide to go shoot people. That's a personal choice, but it's not a very good one.
I agree with John. There's a huge community component to it. So I think it's not solely a personal choice, personal opinion on that. And, when I was working at a prior institution, we had someone show up with multi-drug resistant TB. That person was locked up in the hospital for an entire year until we treated that, and with a policeman outside the door. And so to me, walking around unvaccinated is dangerous to the community. you're more likely to get infected and more likely to transmit infection to vulnerable people. So to me, it is not simply a personal choice.
Yeah, and that's what public health is to help deal with those people that are endangered or a situation that's dangerous to the community. And so that's why we can lock them up. As a public health officer, that can be done. That's a public health officer that does that. And I'm not suggesting that any of that should be done, but my point is that public health necessitates taking care of the community, not the individual. That's what public health is about.
I want to thank you for all the work that both of you have been doing and that all healthcare workers have been doing since even before the pandemic started, but especially right now. And I want to say thank you just once again.
Sure, Morgan, this was enjoyable for me, and I bet Michael enjoyed it too. So likewise, we both work in fields that sometimes are not fully appreciated, and we appreciate the work that you're doing very clearly.
Thank you.
Thanks, Morgan.